my own expressions of sympathy and condolence to the family and friends of Lance Corporal James Johnson and Warrant Officer Dan Shirley, who tragically lost their lives in Afghanistan this week. Mr. Speaker, the Prime Minister has this week published yet another government review of the National Health Service. But what does it say about him and his government that after 11 years, 1 1/4 of all British people now face mental health problems? Every single day, more than 1,700 children are prescribed antidepressant drugs, and millions of mental health patients, some of the most vulnerable people in the NHS, are still having to wait for 3 years to get help. Would you agree with me that we now have a two-tier health system in which millions of mental health patients are being left behind?
Mr. Speaker, let me just say we've increased spending on mental health by 31% in real terms in the last 10 years. There are now 60% more consultant psychiatrists in the National Health Service working, and there are 20% more mental health nurses. Now, that is only possible because of the investment that we have made in the National Health Service, which is far beyond what any of the other parties offered or promised at any election, and that is why there are 80,000 more nurses. That is why we're doing 1 million more operations, and that is why today this party, and I believe the whole House, should be proud of 60 years of success of the National Health Service. I am proud it was a Labour government that created. I hope it will have the support of all parties in this House.
He's doing it again. He's confusing a list with an answer. He's confusing a review with action. There is a mental health crisis in this country today. Even the new president of the Royal College of Psychiatrists himself said this week that our mental health wards are, I quote, unacceptable, uninhabitable and dangerous. There's no excuse for the Prime Minister's complacency. He once again relies on a promise made in a review, but when will he act to introduce a maximum waiting time and equal rights for all mental health patients?
Mr. Speaker, I think he forgets that one of the purposes of our policy is that less people are in hospital and more care is done in the community. But I can tell him that real investment in adult mental health places has increased by 1.2 billion. We've spent over 5.1 billion on adult mental health services last year compared to only 3 billion in 2001. And capital spending on mental health hospitals and hospital accommodation has been rising. And yes, we want to do more, but we can only do more if we invest more in the National Health Service as a whole. That is our commitment. It's not clear it's the commitment of all parties in this House.